I'd like to call this meeting to order since we already have a quorum. And the rest can catch up as we come in. Are there any public comments?
Madam Chair, no one signed up,
No? Okay.
but I don't know if anyone from the stakeholders either can make a public comment now or under announcements from any non-member.
No?
No?
All right, then let's go on to approval of the minutes. I confess I didn't read them.
Motion to approve the minutes is presented.
We have a first and a second. Anyone want to discuss it? Call for the question. All in favor?
Aye.
Anyone opposed? Motion passes. Discussion and possible action. Transitional services after detoxification that we saw in the news and the newspaper. Dr. Gonzalez?
Well, here really, Madam Chair, is going back to the work group to see what is being done, because if I can go out of order and tell you that the detox is going very well. We submitted the preliminary application for the license. We have to have a license to operate detox. And Redline Architects, the architect has submitted the preliminary design all for approval to. Once that's done, then solicitation will be done for contractors. And so this is, even though it's still gonna take time, going pretty fast, so the next step is what we've been saying, we now have to look at transitional services. And I know, folks like SCAN already have limited transitional, but we really don't have, just like we were lacking a detox, we're lacking good, sound transitional services to tie them in to rehab and residential that we do have limited to SCAN and border region. So that's why it's on the agenda for you all to discuss, how do we come together, and just the way you all address the detox, we also need to start now looking at transitional services. So
Okay.
it's up for discussion.
And we have two work groups. One is detox transitional support, and one is transition aftercare. Do you want them both working on it? Do you want them to be together?
Well, why don't we ask the experts, who's here from SCAN?
Here.
What is your recommendation? And certainly then, our drug and alcohol dependency counselor, during that phase, what works best?
What I have seen, like a lot of the clients that they complete residential program and they're homeless, they go back to the shelter, Bethany House, and sometimes they are using around the place and they relapse. So I think that transitional aftercare is really, really important, because they are really not using, and a lot of them, they're homeless and they're having problems. Of course, I also see the ones that are homeless and they are using. And like for us, sometimes it's very hard to get in touch with them because they're moving from place to place. And so both are really important, but I think the aftercare is really, really important because they're already stable, but they
And then
don't
they
have
relapse.
a place where to live. And they go back to the same environment and they relapse.
Were you gonna say something?
Yes, because on the news I did see, and I hadn't heard it before, was that Councilman Bali had suggested the homeless and
A wet
tying
shelter.
in and stuff like that. What is that happening, or what is going on there? Because right now she referenced homeless, like, having to get the service, but we know that not everybody who is addicted are homeless. So we do have those that are and those that aren't. So what was his idea, or what was being proposed with City Council?
And that's part of transitional services, is to link persons who are under the influence, and they need to be offered detox. When we will have a place, so now we can. what Councilman Bali was asking then, can we already add what is called a wet shelter at the detox for those persons who need to spend the night, go to sleep, rest, and then start offering them, which is part of transition, but then transition is also someone who's detox, already done the 7 days of detox, and to begin now residential or rehabilitation treatment, this other service is the one that links them. And so there has to be a bridge, both for those persons who just are in the streets and then those who finish detox. Otherwise, they will relapse, we will lose them. And so we want to connect them to the services that have residential treatment, like SCAN in Border Region, but there's a bridge part. And so that's what the discussion is, how do we do it? And then how do we tie in those folks that are in the street to detox? So Jesse just walked in, who deals with this all the time and may want to weigh in.
Interesting, as I walked in, I had seen that news story, and I have some concerns.
Yes.
We move a population that's homeless, that may have co-occurring disorders, psychiatric disorders there. And we have clients coming in to detox, coming out, coming into residential, coming out, running into a situation where there may be substances because they're using. It's not a good idea. I'm all for a place for them, but not where we're doing our stuff. And look, Border Region, MHMR is doing a wonderful job with the people that are homeless. Let them do the job, and let's just not say, oh, okay, we have a place here because we're doing detox. Let's put all the people right here. It doesn't work for me. I didn't like it. And that's just my take. And I am very sensitive to those that are homeless and that have psychiatric issues and that have co-occurring issues. But we need to have a safe place for those that are transitioning, detoxing, and in residential. And so when I heard that, and I said, that doesn't make sense at all. It's just like, okay, well, we have this idea, we're right here, we'll just put them right there in the basketball court. No, that doesn't, to me, it doesn't work.
And I agree, because, and that's why, the reason why I brought it up is because as I started looking at the posting on the news, people started commenting on it, and they started having that negative feel that we're trying to resolve by saying there is help, but I think it'd be very overwhelming to be able to do that component and then deal with this other, the detox.
Well, both Judge Tijerina, the mayor, and the city managers and council voted no. Let's concentrate only on the detox. Let's get that done.
Okay.
And like I shared with all of you, our preliminary application to the state for the license has been submitted. The architect submitted the design for approval so they can now hire a contractor once the plans are approved. That's one thing. Now, and the wet shelter right now is not gonna happen at the detox facility. The question now is, Jesse, what you and the subgroup was talking about, and Anna, is how do we assure there's transitional linkage from detox to residential to rehab? And that's the question right now in this item for discussion. And you all, I think, have become very respected because, one, you accomplished to get the city and the county to work together and commit to a detox. Now we don't want to lose folks from detox to treatment, so that there's that transitions. So what's your recommendation? What's the plan?
Look, any licensed professional counselor that's going to be doing the screening, the assessments, doing the work, they're going to be responsible for the case management. And that's our responsibility. And so we have to refer them out, and we have to have linkages. And obviously we'll have trainings to make sure that we know where. We will collaborate with Border Region HMR, we'll collaborate with different people. but the LPCs that are working there doing those screening assessments based on the needs of the clients. And the reason we're doing, having LPCs that are there is because we know that they all are gonna have co-occurring psychiatric and substance use disorders. And so we have to make sure that we take care of the mental health also. You have to treat it concurrently and aggressively. The drug is just a symptom of the psychological problem. And so, yes, will be a responsibility, and that will be, I believe it ought to be in the job description of the LPC that's working at detox, or even the residential, to do that.
So as part of the protocols and operating procedures, to make sure that that's part of the job
That they
of the
get
LPC.
referred to the homeless or residential treatment programs for people that have those type of disorders. Because we cannot handle that, and if we are blessed enough to get the sheriff's grant, the one that we wrote, we're gonna have plenty of referrals. We're gonna be full right away, because, you know, they're gonna be referring into the program. I don't know, have you heard anything about it?
Not yet.
Not yet, you know, they did send us something to respond to them recently, right?
Which is a positive.
Which is a positive. So the deal is, I wrote a grant, and Dr. Rodriguez, the budget, wrote a grant in December so that we could do medically assisted treatment in the jail to transition those people into our detox program. You know, so hopefully, and we're going to be using Vivitrol. So this started with that meeting back then. So hopefully the grant will get funded. But yes, it'll be the job. It'll be the protocol, part of the protocol for us to make the referral. Just like if somebody comes to me, I'm going to make the referrals that are needed. And just like if anyone goes to any of the LPCs here, we're going to do that. That's our job.
Okay. Well,
So, Madam Chair, then I think the recommendation, Anna, were you gonna say something?
Yeah, in the last navigation training that we went to, they introduced a new term, what is a warm referral. As to what before it used to be, just give them a referral, and it's pretty much her responsibility to seek out the service. Now, adding on to what Jesse was saying, to the LPC responsibility of case managing is making sure that the client made it to their appointment, that you scheduled the appointment. And that would be one way that we can assure that the service is being provided and not just giving them the paper and, well.
drop through the cracks.
Yeah. I think even in the MAT grant, we wrote about that. We wrote about the wraparound services and about how there had to be that case management where it actually gets done. We just don't give them a referral. We have to link them up. And so there has to be, nowadays in all the grants, they're expecting there to be more active case management, right?
Well, then that's, I guess that's the recommendation from the group, and so, yes, part of the protocols are gonna have to be made that, yeah, the LPC, that the licensed professional counselor and the caseworkers do follow through that they were, because that, you all noticed it, and feedback from others that was a gap. First thing, the big gap was the detox, and now hopefully that is gonna become a reality. So the next gap is that follow through of transition to treatment, to get them to scan, to get them to border region, to get them to the appropriate provider, and to continue.
And eventually, you know, I mean, we're gonna refer them to scan, obviously, after the detox, without a doubt. They're the ones here in town. But eventually, we hope to have our own residential program, because, you know, if we are gonna get, what did we say, 140 clients from the jail a year? You know, I don't know if SCAN can hold 140 clients, but, you know, if we have our own residential program combined, you know, there's enough for everybody, you know, and if we can get our residential program in the phase 2 that we've talked about in that area, that's gonna provide support to our community, you know, and we'll be making referrals still to SCAN and the border region, and we'll have our own residential program, and you know, and obviously, even the residential program, we're gonna need someone to run it. You know, that's gonna have to go out for an RFQ, you know, because, you know, the committee can't run it, I'm not gonna run it, it's gotta be an agency that runs it, right? And even the detox services.
Yeah.
Right?
Madam Chair, Jesse had a good point as the detox rolls out, that is part of the plan. And money's already on the city side of being generated from the municipal court violations. $20 of each violation is going to this fund. And so that's already creating some. to make sure that for operations, and one of them will be to hire a director. You have to, and then pay the psychiatrist, pay the medical staff, the nurses, the aides, the security, the cooks, because it's all gonna take money.
And
so,
that's gonna have to go through an agency that specializes in that, right? That has done that type, and so when you put your RFQ out, you're gonna ask for the qualifications and you go through the process. But it has to be an agency that specializes in that because it has to be someone that's gonna take care of the money and make sure that it's used appropriately. You know, we've had here in our community some very bad experiences back in the 90s where monies were given to agencies that were not from our community that just used the money badly.
It just brings a good point. This is why the city and the county are in the process of developing an intergovernmental agreement to develop and run a local government corporation that will be the oversight. And to make sure that they hire a formal agency that knows how to run a detox and to hire the staff, but it'll be under the oversight of a local government corporation. And that can seek funding because the money that the city will generate for operations not enough. We're gonna, now that this is a reality, we're gonna go back to our friends at the hospital, that they also pitch in. But that local government corporation is gonna be that oversight to make sure that they hire the right company to run the detox and to continue. Because Jesse's right too, the city and county are gonna continue to grow. So there's gonna be more need than what we have the capacity right now. We're lucky that we do have SCAN right now in Border Region, but at a given point, I agree with Jesse, there's gonna be more need, unfortunately.
Yeah, our whole goal, even when I was back at Laredo State Center, MHMR, when I was Deputy Director of Treatment and SCAN, the whole idea was always to build capacity for a community. And that's what we're doing here. And, you know, the way I see it, and I'll be honest, the people that are here are the ones that are invested. and you know, people that are here, I trust. And so whenever you all put the RFQ out and you make those decisions, you're gonna make them on, okay, who has been invested in this process and who has not? Because, you know, I think all of us want the capacity to build. And I can tell you, I've been 33 years, you know, I'm 62, you know, somebody has to do this, you know, in the future, you know. You know, I'm gonna be in private practice, and that's what I wanna do, and just keep it that way without doing all these other things, you know. And so we have all these young people, you know, like Anna, she's about to get her LPC, I'm very proud of her. You know, we did the supervision, so she's about to get her LPC. We've got a lot of LPCs here, LCDCs, people in the community that now have to step up. You know, the days that it was myself and my wife and Luis and Isela, they're gone. You know, now we have Kike, and you know, we've got all these other people here that that can do this stuff.
Adding to what Jesse's just saying, I think the commission is a good cross-section. You have stakeholders, you have advocates, you've got providers, you've got professionals coming together, and people who just care, because this issue is just not gonna go away.
No. Okay, well, thank you so much, and you'll put that into some sort of writing? And have him check it, make sure that that's what he said about our transitional services suggestion. B, education and promotion on drug and alcohol use and prevention. Colleen.
So we're, I guess the year just started again, and so we're gonna get together with the subcommittee, and we're gonna start discussing the next 6 months. I know that right before the break, there was a concern regarding vaping, and so youth vaping. So Ms. Quintanilla wrote up a script, and so we can get that produced via PAC, or, you know, I have the availability to do the videotaping, or Mara had suggesting doing it there at Webb County. We can make arrangements, we can go ahead and do the production, the video production, so we can go ahead and get that going. But so Ms. Quintanilla did write up a quick script, and she did have some quick statistics. I went on to the Texas Health and Human Services and printed out, just a fact sheet so that if anybody wanted to know a little bit more about vaping and the risk that teens have now, just take a look at it. I know with Crime Stoppers, we've received an increase, like you cannot believe, on students vaping in the classrooms. And so we're looking at it in a different viewpoint and kind of telling them what the consequences are administratively and also long-term. So that's something that we're working on.
Have y'all tried reaching out to LISD, like VMT, the
Media,
Yeah, I know they have a
Communications
and
department.
arts department, and maybe having them
Produce
do
it.
maybe a competition amongst the students that who can produce a better video, being that they are the targets, being that you've seen an increase in students, and VMT has it has everything from the software to the talent to the actors, because they have theater also in VMT. Maybe asking them if they want to do some sort of competition and in turn get it out. Obviously, the reward would be to be featured out on KGNS or whatever.
Because we do have another, we have the prom coming up, and then we want to produce a prom video or a
Spring
don't
break.
drink and drive.
Spring
So
break.
the spring break and stuff like that, so we can definitely look at that. Ms. Quintanilla, you think you can connect Dr. Villarreal with us?
Yes, that's what I used to do when I was in charge of Crime Stoppers at Laredo ISD. We always used VMT, and they usually tipped the kids from the class who wanted to get a higher grade or an extra grade or whatever. And if not, then we went back to our LISD police, and they would always get the kids who were always in lap and in trouble and stuff. And they would ask, does anyone? And yeah, they would volunteer. They would volunteer to be in it. So, and they were very good, and we won plenty of awards at the state, local, international, everywhere. So even, national too. So it was very good, and unfortunately I retired in 2004, and I don't know what happened to the mess. We had all these things that I left behind, and now there's nothing. There's no Crime Stoppers in LISD. So I'll still ask Dr. Villarreal, because she's always said yes. She never says
I don't
no.
think she's there anymore.
Yeah, she is.
She is? She's still there?
Yeah, she's not gonna quit till, I think, May.
Okay,
So in the meantime, I have some way to get to.
good.
But yeah, it's a good idea. I think we'll work on that.
Because you have the talent there, they have a theater department, you have obviously production there, they have the software, they have the computer. It's a one-stop shop, and they're all.
And they have their cameras.
Mm-hmm.
They have everything.
They have the state-of-the-art,
State-of-the-art
they have-
equipment.
Yeah. And that's what we do at the judge's office. Maybe in court we have to do a competition amongst the students, and they come out with some
Very
really
good
good
things.
ideas.
Yes.
Really good ideas. So being that vaping is amongst the students, we'll have a project tailored to the students because they can relate to that since it's amongst them.
And what I have suggested, because before, with Crime Stoppers, I don't think it's changed. We had to have papers signed by the parents and the students that they were allowed to show on air and so on and so forth. Because way back, I'm very old, way back, the kids used to go across the river, right?
Right.
And there were some police in Mexico who actually stopped our kids who had acted in one because they thought they hadn't been arrested. So we have to be careful with things like that. We have to have the parents sign off.
A waiver, yeah.
Yeah. So just FYI.
Well, thank you to you, all the commission members, for taking this on and on the broader promotion and education and addiction and alcohol use, but certainly with vaping, and Deputy Chief Maciel can tell you, we've already had a few hospitalized cases here, and in Texas statewide, it's on the rise. The thing is, they lace the materials you vape from the instrument itself to what you put in there, and yeah, it's laced with different chemicals and substances.
Yes, we have some
drugs.
pretty good statistics.
Yeah, and as a matter of fact, right now, the biggest problem, I say, is where the schools are, they have administrative discipline. They're not prosecuting the juveniles for further. And so, because based off of however much the amount is. So, what we're saying is, whatever amount it is, you're not supposed to be doing it. But I guess it's like a slap on the hand for the kids and they get to do it, but they have found THC in some of the stuff that they've tested within the schools.
Yeah.
And I wanna say I got 11 tips yesterday, right after they did a presentation. So we partnered up with the discipline management department with UISD, and they do the promotion within gangs, bullying, cyberbullying, and all that stuff, and then they add Crime Stoppers at the very end, and they say, if you know of anybody who is doing vandalizing, bullying, or all these other things like vaping, call in and report it. We had 11 tips come in from one school of students that are carrying or selling what do they call them, the little cartridges, yeah. And so I did speak to UISD police, and they said, well, we'll turn it around to administration, and it's like, okay, well, you're the police, but it's the way that the school policy is written, that administration gets to decide whether or not they do anything about it.
And that goes back to the law. There is a law that says if a school has more than 3 felonies, they lose their federal funding.
But that's a positive, because you see how your message creates that
Yes,
that
turn it in.
voice, and also, it can generate information that probably can be passed on to us to follow up and probably dismantle these kids or who are actually the
Off
organizers
campus.
off
Let's go
campus
off
selling.
campus, if we can't do it on campus.
Like the one we did with Narcofish online. That there's a whole world online about drug selling. So it can lead to some things.
Yeah, and with the program, the way that we have it on the mobile app, they send in screenshots, they send in social media links, their Facebooks, their Snapchats, and so that's when it gets turned around to LPD, and LPD will go into their investigative and do the Snapchats and stuff like that, and we'll find stuff out and then link it back, and that's how that's been successful. But we do see that vaping is a problem, and it's going to continue to be, even though I was looking at it, but this has been, e-cigarettes have existed since 2011, but right now it's like the odorless marijuana and all this other stuff that just kind of emerged, and it's the popular thing. It's the cigarettes of the 90s or the 80s.
And because
or whatever
it's called vaping, the students tend to think, well, it's just vapor, it's water.
It's not smoky.
And so that's how come a lot of the younger ones are like, don't be a kid, don't be a baby, says other words. And so on and so forth, and they're getting wet and all.
Yes.
Yeah, all sorts of things, yes. They're getting sick in a lot of ways. But I'll call Dr. Yadel tomorrow and I'll get that rolling, and then.
And Madam Chair, on support from the city, and Public Access does a great job in doing videos, but yeah, it's one more thing on their schedule. In following up on doing your resource directory, making it more user-friendly with Mr. Pitland, we've got another person interested in giving us another quote and doing the same thing. And so one of the things he does, this other company does videos. Besides doing computer data, he also
Which is what
does
I want
videos.
him to do, because it was a very good presentation.
Well, and so options are coming up to support this commission on doing education and promotion messaging. And so we're getting a quote from him. We do urge you to go back to the city's website and look at the resource directory, because changes were already made where you can click on a section and it takes you to that section. And you don't have to scroll. And that was done through our IT folks.
Okay.
So please look at it and then let us know.
So, but has Mr. Pitland started or anything?
He hasn't started,
Because there's no money.
Well, we have to find the money, but his proposal was too old, so he updated it and he just sent it to us. But in the meantime, another person submitted another one. Because we have to go public once we start soliciting for a project from government, and from municipal government or county government. And so we're meeting with this person as well, but one of the things that caught our attention is that he does videos and very inexpensive and very good.
Are they from Laredo?
Yes, they're from Laredo, and so it's a local company, and it's something that the city's supporting. There's a structure called Mile One that are incubators to start
We had a
different
meeting tonight.
businesses, and this is a company that started from there. And so he's gonna hand in his proposal too. Mine, I mentioned it because for health promotion, he's already said, if you need help to do educational materials, I'm more than willing to. So if you want, we can invite him so he can present and show you what he does.
But it seems to be different from what Mr. Pittman.
Well, he does both. He does both because
One has
he turned in
more
a proposal
extensive.
for that one too, for the directorate. But even for that, we do recommend that you look at it again and see the changes that have been done already. Because there are some changes that were done.
I'd like to make a comment. It's interesting, this morning I had a college student with 96 hours that I'm working with on some issues. And she reported vaping, and we talked about that. And she said, no, I'm sure that where I get my stuff, it's okay, it's not gonna happen. Even someone at that age, and the brain is still developing, they have that problem. But I thought, and I don't know if this came out of SCAN's Community Coalition or Prevention, and my wife raved about, she raved about this presentation that was made from either SCAN's Community Coalition or the Prevention program. I don't know who did it, but it was from SCAN. It was done at LADA. And the kids were enthralled, and my wife was very, very impressed. So, if you all know where it came from, the Community Coalition, or it came from, maybe that would be a presentation I'd like to hear. So if you all know, I think that'd be good. But I really loved it.
And one more thing, that other PSA that we prepared, I never saw it on TV.
The city's PIO did follow up, and the media insisted they showed it. And so we've asked them twice give us a list of the times and days you showed it. They haven't given it to us. And we resubmitted the request for them to show it. But I know in public access, we are showing it. And we're asking the same thing.
Yeah, but I'm saying like on TV around 6 p.m. or something where everybody's tuning in, 6:30.
After work, they're coming in from work.
Yes, because otherwise, we're spinning our wheels.
It catches your attention. It's a nice video.
It's out there.
Yeah.
Okay,
follow up
well,
again.
we'll continue.
You posted it on the Facebook page, right?
Yeah, it's posted on the Facebook and on the city's website too.
You will be posting it again, that way we can maybe find a venues to push it out.
Okay, we go on to C, Dr. Gonzalez, attendance and makeup.
Well, here, Madam Chair, everyone, I think got a letter from the chair to make sure that on the commitment, and I don't know if people have any questions or comments. Because by the bylaw of the commission, it does have an absentee rule of 3 absences and you're terminated. You all can bring this up to council and the county again to change it, to discuss it, but right now that's what it is, and so the chair did send out a letter to remind everybody about attendance.
Okay.
Well, I know, with regard to that, I know that I had brought up maybe changing the time, maybe the date, I don't know, and this, I would like to have discussion just to see I know personally, there was a season where my mom had been sick, and so I wasn't able to come, and then January gets busy for us because we have our biggest fundraising event. But other than that, we're here because we want to have, there's a commitment, but then there's things that happen that don't allow us to come in. But for the most part, is there a consensus that 5:30 is okay, or would you rather another time for those that are members?
At our end, we're flexible at the times you want.
I'm flexible as well, so.
Yeah.
Does anyone have a
I'm pretty
comment?
flexible as long as I have notice, I can put it in my schedule.
So
Mr.
does anybody
Thompson,
prefer to
Do you
meet earlier?
prefer an afternoon rather than during the day because of work?
I do. I would have attended the one that was canceled, except I didn't realize y'all wanted us to, email in and say I'll be there. I just assumed if you didn't email, you're gonna be there. Oh, by the way, I just received a text from Mr. Montemayor. He's got some medical issues, that's why he's not here today.
I just wanted to comment. I'm here representing Board of Region. The two individuals who were previously coming are no longer with us. So my name is Catherine Mejia. I do get the emails because we have access to both individuals' emails, so I can just reply to, I guess, whoever sent that initial email.
Okay. Anyone else? So you want to come after work?
I prefer 5:30. I just, I'll make sure that I text that I'm coming next time.
Madam?
I'm okay with 5:30.
Okay.
I'm okay with 5:30. I mean, if you guys, if we can meet earlier, maybe twice during the year would be ideal, but 5:30 works for me.
Stephen?
I'm good with 5:30.
Me too, 5:30. Colleen?
I'm good with 5:30, but there are some times that my office is made up of 2 people and I have to do presentations, and I may not be here. That's the only thing.
If I may, Madam Chair, just to remind, and it's working with some of the other advisory boards, commissions, that it's a public meeting, so we must be at a public place, this one, and you must have someone presiding, but others can't, it is allowed, others can join in by phone. You just need to let us know so we can put in the public phone, the open phone, so you can be picked up. That's helping a lot of the other groups as well.
We tried it
Helping
once.
them in the sense of meeting quorum.
Meeting quorum and participating, yeah. So it's a challenge sometimes, but, we'll do it. And
How many
sometimes
do we need?
you need 7 for your quorum. Today you have everyone here except Mr. Montemayor.
Oh, we met quorum.
And you met more than
Yeah.
quorum.
Okay. All right, so then we continue at 5:30, is that the
Yes.
consensus? Yes.
I have a question, going back to the emails when they send out the reminder. Do we reply all? And I don't like to reply all
No, me
because
either.
we all have so many emails to check. So do we have to reply, or is just assumed that we will be here, and in
Yeah.
case we can't make it, then we
Just
put,
reply
I
to
won't
Dr.
be there.
Gonzalez or Adriana.
Because that's what Mr. Thompson was saying also,
Mhm,
and
yeah.
I agree with that.
I never reply, but
As long as you don't chime in that you're not coming, it should be assumed that you are.
Okay.
Well, I think we can do it, we have been depending on someone letting us know, you don't have to reply to all. But if everybody's okay, we're just gonna assume if you don't reply, you're gonna be here.
Mhm.
Right.
Yes.
I have trouble with meetings and board, if it's easier, I think, replying to one person and saying, yes, I'll be there, no, I won't be there, just to, as common courtesy, because.
It'll be yours. If you wanna reply, fine. If you don't, we're gonna take it. You'll be here.
And besides, I leave it on my email, so I'll remember that, oh, there it is, DAC, and I have to go.
Yes.
So I like to reply and then leave it on there as I said yes.
Okay, so.
Whichever, as long as we've got a quorum. All right, then let's go on to, well, we already covered the
We already
update
covered
on the
the-
detox facility. And the new services for the detox and treatment, we also, Jesse covered.
Yeah, and the only thing to add, I don't know if others have any more to add. I know vaping came up. PD has a task force that's working with the different agencies to address the grant on behalf of the sheriff. these are all new efforts for treatment and detox. So that's why this item was here, because last time there was some discussion of what else is there. So that's why the item. So I don't know if there's anything else. Jesse already
I
talked
think
about.
the only one thing that I want to add is, and what we've discussed in our committee, is that now that we've moved forward on the detox, this is a year we want to go on to phase 2 and we really work on the residential piece. And that's where we want to be at. We want to start working on how is this residential piece going to be, what's going to happen, because eventually they're going to have to build it. And so that's what we want to look at next. How are we going to do residential? What's it going to look like? How many beds? What do we want? And so that's where we're at, which we called in our committee phase 2, residential treatment. So that's what we want to do next.
And will that involve, will we have someone from the city, someone assigned to start looking for money, for grants?
We can.
Someone that's always gonna be applying for grants for the next phase. We've already started on this one. We've got money coming in from the municipal courts. The county is doing their part. Now let's start working on getting money, more money, and twisting the arms of the hospitals.
Chief, anything you want to add on heart?
I'll cover it under announcements. I want to present something.
All right, anything else on services for detox and treatment?
Madam Chair, the only thing is the adult probation mental health court reached out to us in also being concerned about barbiturate use. And we know that's on the rise. That had gone away, and heroin went up, opioids, and then cocaine as well. And certainly alcohol has always been there. But she expressed the concern and asked if we would bring it up, if anyone has seen, but she's getting literature, and some of the persons on the behavioral health side also have co-occurring, but with barbiturates. And statewide, they're seeing a rise as well.
State some of the things that are barbiturates.
Uppers, simply put, are different chemicals and drugs that has dual effect. One can sedate, but also excite, keep you up. I don't know if the LPCs have seen.
Yeah, that's what I was gonna say. There's some diet pills that are also.
I don't know if you all have seen a rise in barbiturate use.
Not in my practice, I haven't seen any, and I don't know, Scan, you all see so many people.
When it comes to barbiturates, it's really rare that we see anything like that. I mean, benzos, that's.
I see a lot of benzos.
And maybe ecstasy?
There's ecstasy, yeah. I mean, I've seen more ecstasy than barbiturates. I haven't seen barbiturates in a long
Yeah.
time. It's been years since I've seen that.
I recently I saw a case.
Yeah,
That's
although I
good.
know the kids have
But-
parties where they mix a bunch of different pills and barbiturates could be thrown in there, and they don't even know.
Yes,
Pregnancy pills.
that's been going on.
The state is more concerned with benzos.
Yes.
Of course, yeah, there's a lot of use of that, a lot of Xanax.
On anything that you've seen?
Same, pretty much the same.
Well, that, again, and we'll be bringing you to the commission members the different drugs that we see are trending, like certainly vaping, opioids are right now got the attention, with heroin in our case, but benzodiazepines, which are antidepressant to calm you down, is also on the rise. And statewide, they're saying, I don't agree with the state, they said we got a handle on opioids. I don't think we have a handle on opioids.
Oh, no.
But they're concerned about the rise with benzodiazepines, which are the antidepressants, calm down.
I think when they say there's a handle on opioids, I think it's from the medical industry. Because I think doctors themselves, because of the liability, are keeping from prescribing. It doesn't mean that they're out there by some other means.
Yeah.
So do we really have a hold on it?
And we're not gonna have a hold on it here because people can go across the river and get medications and bring them over here. That's all the same thing that we've seen, in the 80s and 90s, and, they're more available here.
Especially the black tar.
Well, we'll keep you abreast as things come up, and certainly we depend on the providers, the stakeholders, and certainly all the counselors who are seeing it on a day-to-day.
Oh, I saw something, I don't know if it was just clickbait or something, but there's THC laced toothpicks.
Oh, yeah.
Is that a thing?
I saw that too, yeah.
So the kids could
I haven't seen that.
It was
have a
on
toothpick in their
Newsbreak
mouth and it's
yesterday.
laced with THC.
On the app, Newsbreak.
It wouldn't surprise.
Food.
Yes, there were
Candy,
toothpicks that are laced. And they're
Makes
sold
you
in
wonder
little
if these
boxes.
people would apply themselves to do something good, we would probably find the cure for cancer or something by now.
It's science. It's the Walter White effect.
Okay, thank you. Let's go on to announcements. Chief?
I just briefly brought some information to share with, pass it on some statistics on overdoses and on our drug traffic safety enforcement. So we look at overdoses first, and I'll just say that this is kind of like raw data. It doesn't really capture, what we're trying to see is, are we capturing the actual overdoses as a police department? In 2018, we had 309 overdose calls that, as a police department, we responded to, and by 2019, 471. An increase that we're looking at is because we started really diving down into our officers to make sure that they are actually documenting overdoses instead of medical calls. We found out that a lot of our responses were overdoses, but maybe were not captured in the report, and officers were documented as a medical call. So clearing that up, I think we see the increase. Plus, and looking at that, it changes, but the number that stayed pretty much consistent was the overdose deaths.
There was just two handouts.
Yeah, it was two, and I just passed it all on.
I didn't get
I'm like, this is motor vehicle, what are we talking about?
Okay.
Okay, never mind.
There was two sets that went that way.
We got it. Yeah, two cents.
That's fine, go ahead. We'll share.
Yes.
So overdose deaths remain pretty much the same, 22 to 23. Again, this may not be an accurate number because the ME sometimes reports it as natural causes.
Yes.
Really?
Yeah.
Even though, and I think Doc can probably explain a little bit better, the narcotic or the drug created it.
Right,
But-
brought it on.
Part of it is that, and then for the medical examiner to declare it an overdose, she does a tox panel of over 200 substances, so sometimes she waits for that and makes the determination, was it really the drug or was something else that caused the death? But even 23, for our population is a lot.
Yeah.
And in 2017, we had 43 overdose deaths. Then they went down to 22 and then went back up to 23. And so we have a problem with overdosing and death.
Is some of, well, I mean, the increase in the death is only one, but in the overdose calls, could some of this be attributed to that fentanyl?
Yes.
That seems to be trending?
What the thing here in Laredo is the potency of the drugs. They're fresh from coming across, they haven't been cut up as you find them up north. And the price. So it's cheaper, you're able to buy more often, buy more quantities. So I think those are some of the factors that contribute to some of these.
We saw a presentation with one of the DEA agents, and it said something as small as a little packet of Sweet and Low.
Yeah.
could kill up to 200 people.
Oh, yeah, that's fentanyl, yeah.
Yeah.
That's incredible.
You know, Chief, though, it's really interesting, these numbers, because you look at the number of overdoses, the overdose reports, and the overdose death, and I kind of look at it another way. So, you know, maybe the reason why everything has gone up, yeah, we're seeing a lot of opiates, and we have these overdose reports and overdose calls. But maybe the reason why the deaths have come down is because in the last year, we've been through the trainings for naloxone, and yeah, so we're doing Narcan, and we've got people that are more aware to prevent the overdose death. So yes, we still have the problem, but because the community is more aware and people have been trained, you know, maybe with a Narcan, you know, it's helping out, or maybe with the awareness that we have. So you can kind of look at it as a double-edged sword.
So these numbers might go down when they do the 2020.
Well, you know, obviously you can't just take 1 year, but if you look at it over time, you might be able to say, wow, these workshops where people got trained in Narcan and you know, all these things helped out. You know, the heart program and all, you know, the rapid response, all of that helps out. And so it's preventing the deaths, even though we have a problem with overdosing and the problem with drugs, and it's still going up, but we're preventing the death. And that was the whole idea of those trainings that we did this last year.
Jesse may have a point, because the calls and the reports are way up, but the deaths are the same and down from 2017. And so maybe it is, and to your credit, because you've been promoting training, more physicians are being trained to treat and prevent overdose, more community groups. I think SCAN's got a project, Pillar's got a project, we've got a project to teach people to use naloxone, the spray, to prevent death. And then issuing that out to the families and training them, so.
Are they capturing the sepsis death, the infections of the needle, as sepsis as a result of a drug?
I mean, if she gets an overdose death, she'll cite it.
That it's not necessarily that they died of an overdose, but they died of an infection.
And then that's part of the reason what Chief is saying, it's gonna be categorized as a sepsis due to secondary infection.
Correct.
But it was done because of the drug, of injecting, yet it's gonna come on the death certificate as sepsis.
They should say sepsis due to.
Those are the different categories that physicians can put.
And there's a lot of little things I just want to mention too.
That's on the
that
rise, sepsis, the death.
Yeah.
There's a lot of little factors that could help us. I mean, one of the things that was done in the drug court, especially in the last 2 years, but especially in last year, you know, as I'm working with the counselors, they're making more active referrals to detox residential, so the people that 25% of our clients in the drug court that are heroin or opiate addicts, they're now being sent out more actively, more often to detox and residential for 8-9 months, and so that's probably also helping too. We had a big chunk of clients this last year that went out. So there's a lot of factors, but the main thing is the grassroots community effort, is what I would say.
I have a question. This is separate from like suicide deaths, right? Because I also was thinking
And I think
about-
some may be.
Some may be, right?
interrelated,
That's what I was
yes.
thinking.
I think that's a
because
very
they're-
good question, because some
Yeah.
people attempt suicide by
Through
overdose.
overdose, yeah.
Overdose.
Right.
So that was also part of what.
And then that would end up in us having a logic fallacy, thinking the numbers are up there, but if a significant percentage are not addicts, but rather.
Well, it's
suicide
still
intentional.
depression, it's still a
Yeah.
mental health, right?
Yeah.
Crisis, but it's different though.
But you know, I mean, there are people that do overdose and they don't have substance use. But you know, if you really think about it, and I know that you all have women's program and all this, the women that we, you know, when I say we, I'm judging on the drug court because I'm the evaluator, those come in, they all have borderline personality disorders, they all have PTSD, they all were sexually abused, and so they're more apt to want to try suicide. But they're also drug addicts. They use drugs at a high amount, and that's another way of them killing themselves. So I mean, you know, yeah, they have access to it and they do it, but I mean, there are people that do overdose, you know, out of suicide, but I think a lot of the ones that we look at, you know, at least in our facilities or when I'm at the drug court or whatever, is because they're using a lot of drugs.
And definitely a correlation, but which came first?
The chicken or egg doesn't matter.
Yeah. And with PD and us, and many of you around the table did address this here also, the suicide, because we ended up 2019 with 25 official suicides.
They
And that's-
romanticize it.
And that, for many reasons, one that, you know, it very high, and we still have 30 death certificates for 2019 that we haven't codified. So it may even go more. And yes, some of them did have co-occurring issues. And again, as Jesse says, which one, as far as was the overdose, the suicide, or vice versa, both are a problem. Overdose deaths and suicides.
But if I'm not mistaken, Doc, in the statistics for 2017 that you put out, where there was like 43, you were very specific about the drugs that they used.
Right.
And there was, the majority of them were heroin, and then there was cocaine. And so what you all put out, it really showed that there was more drug related as opposed to someone that's suicidal that takes a bunch of different things, right? May have other depression or other issues. So yeah, the 2017 report, it was, you said, okay, we'll do utopia, heroin, what have you, right?
And we're gonna update the 2018, 2019 and provide it to all of you.
And like I said, these are just what PD responds to, that we're able to be involved. So, and the way to capture a little bit more accurate information, we've done some internal changes in responding to these. Now we have supervisors respond to overdose calls, and a little bit more paying attention to the actual report of the scene and all that to make a proper documentation of the incident. And with that, also our strategies, the HARD program kicked off late last year. It keeps going on. The project Broken Arrow, where we're looking at areas around town where addicts congregate and, you know, just deteriorate neighborhoods, the quality of life in certain neighborhoods. That activity, that congregation leads to other, you know, secondary and tertiary crimes. So, and these are, you know, it's not just about putting handcuffs on people. It's the other part, the humane part also on our end as a department. So this is a year we're gonna, you know, have these projects to make it consistent and see if we can make these dents come down and just continue these efforts. The second handout I pushed out was on motor vehicle safety as it relates to intoxicated drivers. 2018 was a bad year for traffic fatalities in Laredo. We had 31 deaths in the city of Laredo, traffic fatalities. Of those, 19 occurred at night and 14 were with intoxicated drivers. So the department early 2019, late 2018, we totally took on this strategy of changing our patrol tactics, our enforcement operations, and try to, using data-driven approaches, looking at 2018, what were the hot zones? So we changed some patrol activities, patrol tactics. The result of that, for 2019, we closed it out with 11 fatal accidents. And I think for the first 5 or 6 months of 2019, there was 0 fatal accidents. Wow. So that resulted in only 3 of those fatal accidents were related to intoxicated drivers. So in total, that was a 60% reduction in fatal accidents. The strategies, I outlined some strategies here. The big one at the bottom is using secondary resources so as to not tax our patrol operations, because we still have to manage calls for service versus proactive enforcement. So we have a lot of grants through TxDOT that, targets intoxicated driver, seatbelt, and all that. So using our hot zones, our data, where these accidents were happening, the high number of traffic accidents, through cooperation through TxDOT, we were able to amend our grants to target these areas and to make them 24 hours. Previously, TxDOT would only allow us, you can work this grant, but only between these hours.
That's crazy.
So we applied to the state and made our argument, they accepted it, and so we went forward with that. We also looked at the data, when was our most peak hours, and looking at the holidays, we were able to increase enforcement hours and remove some of the hours where we weren't seeing a lot of activity and moving those enforcement hours to other holidays. So one of the things that we found just through field surveys of our officers doing their enforcement is they were seeing less and less intoxicated drivers. I don't have the numbers here, but from 2018 to 2019, I think we had about maybe 50 less intoxicated driver arrests. And we've queried why. Well, the officers are like, I'm not finding, the people I'm stopping are either getting Ubers or they have a friend driving them. So I think we've made a little impact, and it's kind of thinking outside of the box in a lot of things, using the resources that we have. And we partnered up with DPS, especially along the loop. That was a big hot zone.
But still,
Yeah, and it's one of the ones we continue to maintain a heavy presence.
I can hear them, we live in Lakeside, and at night when it's way quieter than daytime, you can hear them racing.
Yeah.
I don't know,
Yeah,
they're
it
racing.
happens. So DPS helped us fill in some of our gaps. So that partnership really helped. But I think our efforts are going to continue, and 2019 showed us that what we did worked. So we're going to continue to use some of that and tweak things here and there.
I have a question on your deaths. Fatal accidents and death as a result. Does that add up, or it's just the same 28? 28 and 31? Does that
I
add
know
up?
we had some where there was multiple occupants.
Okay. Well, it's not 28 and 31, but actually
Yeah.
counted together. Okay.
So that's just my little presentation on some of these initiatives as part of, drug, attacking that problem and the intoxicated drivers.
That's excellent. I mean, it's wonderful to see that the numbers have decreased so significantly.
Well, the numbers
And how you're using the
Yeah.
data and information to target crime. It's wonderful.
Thank you for sharing this
Thank
with
you,
us.
thank you.
Very good. Thank you. Does anyone else need copies that I didn't have? That I passed on? Anybody? Okay. Well then, call for adjournment, please.
Motion to adjourn?
First and a second, call for the question. All in favor?
Aye.
Anyone opposed? Motion passes. Thank you. See you
Thank
next
you,
month.
everybody. Thanks for attending.